Hello, everyone. Good evening. Apology for delaying. We're just waiting for a couple more people. We'll get messages that they are joining. But let them join in the beginning. Let's start, and then people keep coming and joining. So thank you very much to you all for just a moment. Thank you very much you all for joining this sensitization on accreditation standards for telehealth, which we have developed a standard on. Myself, Dr. B. Kirana, I am the CEO of QAI, Quality and Accreditation Institute. And prior to that, I was the director and CEO in charge of NABH Quality Council of India. Thank you again, and let me take you through this program to you for this. So just briefly about QAI, who we are. We set up as an accreditation body in August 2017. And I can say that we are the fastest developing accreditation body in the world, which is evidenced through developing 10 sets of standards in just less than 3 years. We have a vision to nurture the largest global pool of organizations and people through quality improvement and accreditation framework. And we have set mission to achieve our vision is to conceive and deliver education, training, accreditation, and related programs in partnership with stakeholders using an approach of co-design and co-creation. And the values which we have set for ourselves are we want to be a good listener, we want to get feedback from the users of our services on a continuous basis. We want to be competitive so that people have the options to choose. Transparent in our operations, as we have put all our documents which are required to be put in public domain on our website, and we want to be innovative to keep changes as our core strategy for development and improvement. This is our organogram. We have an advisory board of eminent people. We have 4 verticals. The Center for Education and Training is primarily responsible for delivering training programs in different topics related to both our accreditation standards as well as any other program of general nature. And Center for Accreditation of Health and Social Care, CAHSC, is the vertical responsible for accreditation activities of healthcare, health and social care facilities, including telehealth. And Center for Laboratory Accreditation, CLA, is responsible for delivering accreditation program for testing laboratories, medical testing lab, as well as biobanking. This is a totally separate vertical headed by the board, which is chaired by Professor Vikram Kumar, former director of National Physical Laboratory of CSIR. And then we have Center for Accreditation of Veterinary Facilities, CAVF, which is actually having taken task of developing accreditation standards for veterinary hospitals and clinics, which we have already developed. And currently they are being piloted in 2 different states by the government. And this program is supported by Department of Animal Husbandry and Dairying, Government of India. So we are just developing. So now a little bit on about healthcare vertical, which is still a separate entity within QAI. This board is actually chaired by Professor M.C. Mishra, who is the former director of AIMS New Delhi, and supported by a couple of eminent people and professionals. So as you can see on your screen, we have 12 programs already operational, and 2 programs are being developed at the moment. So we started off with assisted reproductive technology, ART, commonly known as IVF, Center Accreditation Program. And we are very well running this, and we have the largest player, the Indra IVF, as our client, and couple of eminent chains of fertility like Apollo Fertility, Oasis Fertility as our client. Home healthcare is another set of standards which we developed, and home healthcare is again a very new and exciting area to work. And these are the standards which we developed for the first time in India. And this is again has been taken up by the largest player in India, including the largest one is Portia Medical, and then the Healthcare at Home, Max at Home, and now Antara, which is a group company of Max, Antara Senior Care and Senior Assisted Living. They have just got accredited. Now next in line is Apollo at Home as our client. Dialysis center is again another program which is very specific and very specialized, which we have developed, and we have couple of standalone and hospital-based dialysis center already into this. We have Green Healthcare Facility Certification Program. We have Healthcare Facility Certification. We have WHO Patient Safety Friendly Hospital Certification Program based on WHO EMRO region standards. So they are standards coming from WHO as patient safety friendly hospital standards. Primary care, ambulatory care, telemedicine recognition program for individual doctors, and telehealth accreditation program, which I'm going to talk about today briefly on this. This has attracted ISO Technical Committee attention, and ISO Technical Committee 304 has requested us to submit this to move forward with developing international standard as an ISO standard. So now this technical committee has already set up a working group 6, who is now working to develop ISO standard for telemedicine and telehealth. So our standard is being used as a basis standard. So that's a great thing for us. Emergency Department Accreditation Program is a new program just launched few months back, and it is supported by Society of Emergency Medicine of India, SEMI, and it's run very well. We already got first hospital department, which is Dr. Mehta's hospital in Chennai, already got accredited. Now we have already another one, CMC Vellore Emergency Department has applied for accreditation of their emergency department. We have a standard for hotel and homestays, a very specific, very unique program for the first time, which is to ensure quality and safety in hotels and homestays, ensuring the safety for any guests, whether it is a guest, normal guest, or a patient, because the patients are now being, were quarantined and isolated in hotels. The two programs which we are developing at the moment are the hospital accreditation program and transition care, or other way you say inpatient rehabilitation center accreditation program. So these are two programs which are underway at the moment. We got our standards for dialysis center and home health care accredited by International Society for Quality in Healthcare, ISQA, making QAI the first and only accreditation body in India which has achieved this benchmark of getting two standards accredited by ISQA as international standards. Now we are going for our third set of standard, which is for IVF center for ISQA accreditation. We are institutional member of ISQA since beginning, and I was also on the board of directors of ISQA from 2014 to 2016 and 2017 to 2020. And we are also an institutional member of International Society for Telemedicine and Health. And now I am also on the board of directors of ISFTH, taking my position from 1st January 2021. So from just this month, we took off as the board member of ISFTH as well. We publish a journal called QAI Journal for Healthcare Quality and Patient Safety. So anyone interested in publishing their work related to healthcare quality and patient safety might consider publishing in our journal, which is free, no charges for that. This is free online access available journal. This is our mark of accreditation, mark of sustained quality, is a gold seal, which an accredited facility is allowed to use after they got accreditation. Our clients for telehealth, telemedicine program, we have Al Jahra Hospital in Dubai, as our international client. They just got evaluated, and they are just going to receive accreditation most probably coming week. They have done all the formalities for assessment and accreditation. So that's going to be our first international client, and we have two more: India Health Link and FITO, which has applied for accreditation, and there are a couple of others who are in the in way to prepare for and then apply. Why the question basically comes to anybody's mind is why a telehealth providers should sign up for accreditation. So there are a lot of benefits around which can be really felt by the facility, but to name some of them is it helps in enabling the facility in demonstrating commitment to quality and safe patient care. It assures community about the quality of services provided. It helps in demonstrating transparency in practice of telemedicine. It helps in demonstrating that facility function in an ethical manner. It support compliance to the prescribed telemedicine practice guidelines or any regulation existing anywhere where it is being applied in different part of the world. It's a mechanism, basically it's a mechanism to ensure, uh, just a moment. It's a mechanism to ensure ease of storage and retrieval of patient information when needed, because when you're providing telehealth, telemedicine, the storage of information and data is very critical. And so the standards really help in that. A possible mechanism to safeguard from potential legal liabilities is in some risks attached to telemedicine. To prevent from those potential legal liabilities, a telehealth provider might choose to go for using the standards which sets requirements for different things. And if it is documented and they follow those, so do you have the evidence that whatever you are doing is doing as per the defined protocols which are within the boundaries of a legal framework. Accreditation process stimulates continual improvement in service delivery. So it puts the organization on a continual improvement journey, and so that the organization continuously evolve and improve further. And it can also be seen as a mechanism of self-regulation. In absence of any regulatory requirements, it can be held as a framework for self-regulation to establish a mechanism around the standards, so that you can comfortably say that you are complying with the standards, ensuring different legal, provisional, national, international requirements, whatever applicable to specific telehealth provider, are met with. Now, after this brief introduction on QAI, let's talk about the standards. As this is a sensitization program to give you an idea about what is the structure, what are the framework of standards, and what are the content in brief, so that you get an idea about the standards. So the standard is actually framed as follows. They have 10 chapters, and these 10 chapters have been divided into 61 standards. And these standards have been further divided into 239 criteria. So basically, this criteria is actually some measurable component which you can really measure. And after you measure those criteria, and if you fulfill those criteria, it means you fulfill a requirement of a standard. So there may be an instance that one standard might have 2, 3, 4, or 5 criteria. Another standard might have a different set of criteria. So in all, basically, they come together and form a basis of compliance to a standard. And then when all the standards in a specific chapter complying, they form the compliance to a chapter. So it's a step-by-step approach. This chapter, the standard, and then criterion. And you meet criterion, you meet the standard, you meet the standard, you meet the chapter. And when you meet the requirements of the entire chapters, all 10 chapters, then it means you meet the requirement of the entire standard for accreditation. So if you look at this slide, it's give you an idea about how the structure is around. What are those 10 chapters? So there are here 10 chapters, starting from governance and leadership down there to digital health applications. And if you see, these are 10 chapters, and then each chapter is divided into number of standards, right? And then each standard is actually now again further divided into number of criteria. So if you see in all 10 chapters, 61 standards and 239 criteria. Now, quickly taking you through this set of standards. is first is governance and leadership, GAL. As the term itself says, the governance and leadership has been talking about the top management in the organization. So it's about, the management of telehealth facility is committed to and actively engage in quality and safety. So this is what the standards ask, that the management, the top management, who are responsible for managing the facility, they are really committed to provide good quality and safe care to their patients. And the management is also held responsible and accountable for quality and safety of care delivered. So it's not only just responsibility, but the accountability also comes on them, which makes a robust system. The management receives a report on quality and safety of care delivered. So eventually management is committed and management is accountable. So management should have some mechanism to know what's going on in the organization. And so how they know? They know through receiving the reports from different areas, different activities going on. So they receive report that what's going on in the organization in terms of quality and safety. The telehealth facility delivers services and make decisions in accordance with values and ethical principles of corporate governance. So it essentially asks an organization to define its values and ethical principles around which they work, right? And so the organization need to really adhere to their values when they provide the services to the patients, and also to ethical principles. And on top of that, the corporate governance, the basic principles remain the corporate governance, that you really make system transparent, you know who the owner are, and you communicate that how the organization is functioning in terms of delivering the services. They made a commitment in GAL1. The telehealth facility is committed to health promotion, wellness, and disease prevention in collaboration with community and government agencies. So is the role is not just to provide care in terms of telemedicine or telehealth, but also to promote the health and well-being of people. So it's more on the wellness side rather than the treatment side, the illness. So it's how you means ensure that you promote health, the well-being, the wellness, disease prevention, good lifestyles, active lifestyles, and so on, educational part, to prevent in collaboration with the community and the government agency. So it's more on the preventive side. The facility documents is operational and financial management. So how, when it talks about the governance, so governance include operational and financial management. So how you are operating, what is the structure, in terms of organogram, what are the component and constituents within the organization to made responsible for operating the organization. Similarly, what is the financial management system exists to ensure that there are sufficient finances available to run the organization and making it a viable organization in terms of businesses. Now, the next chapter is about human resource management. We talk about the personnel, the people working in the organization. The facility has adequate and appropriate trained and skilled human resources. It's talked about good the numbers as well as their skills. The facility has a documented recruitment process. So when you talk about human resources, the personnel, they start with the recruitment. So you should have a defined recruitment process, and then the performance evaluation. Once the person is hired, then what is the process you have for continuous performance evaluation? So usually you say that you have annual performance appraisal system. So it's the same thing. It's an annual or 6 monthly, whatever way you define, to monitor the performance of the people. Telehealth facility has a continuous professional development program for its staff. So after the person is hired, they are checked for competency, their performance evaluation is being done, then they should be provided a continuous professional development opportunities. And so you develop program for all staff, and then program might include that participation in training programs, participation in conferences, seminars, symposia of a related topic which is relevant to the job functions, and maybe something which you would like to add up into their profile as a continuous professional development program. There should be a disciplinary and grievance handling system in the facility, because if any staff is not happy, have some grievance, so how those are taken care of, or and also if there are any disciplinary grounds for taking any appropriate action against staff, then what they may be and what may be the ground for those. So they should be available, and they should be made available to everyone in working in the organization. A documented policy exists to address health and safety needs of staff. So you also have to have a policy to address their needs in terms of health and safety. And particularly, as you know, and in the COVID time, do you encourage them to go for vaccinations? For example, being a what do you call it, a telehealth facility, you may not have much things around this. They may be all working from different locations. So depending on it's a what type of facility it is. It is a hospital-based telehealth services or a standalone telehealth provider or platform, and depending on the risk to individuals, you have to take care of them, their health and safety. The organization has a documented system of credentialing and privileging for registered medical practitioners. So whosoever is authorized to provide telehealth services, telemedicine services, they need to be credentials and they need to be a credential and then privilege accordingly. So credentialing basically include checking their qualification and experience, the minimum thing, minimum as per law regulation, whatever the minimum thing to be, a qualification of a specific doctor or a practitioners to provide, plus privileging. Privileging is in a process where you, over and above the credentialing, you declare someone responsible for a specific task based on their education, training, skill, and so on. The facility has a documented system of maintaining personal files for all. So each and every staff should have their personal file maintained. At some places, which includes everything around, starting from their detailed CV, their recruitment documents, their certificates, and then their professional development certificates, their appraisal documents, and so on. So everything related to specific staff should be maintained in their personal file. Duties and responsibilities of the doctors who are there to provide telehealth, telemedicine are defined and implemented. Now, moving on to the next, facility and risk management, which is around the physical infrastructure. The facility management is guided by applicable laws and regulations. So based on the nature of facility, it should be governed by whatever laws are applicable to them. There is a documented safety and security plan. So it's obvious that if you have a physical facility, then what is the safety plan for that? What is the security plan for the building? And safety and security comes both from including, from the access point of view as well. The telehealth facility has provision of potable water and electricity during operational hours. So depending on what are your operational hours, you may not be working 24/7. If you're working 24/7, then you have to follow that. You have to ensure the availability of drinking water and electricity during your working hours. There should be a documented disaster or emergency response plan in case anything happens. It may be man-made or natural disaster, then how you will cope up with those situations. There is a documented equipment, including electrical, medical equipment management program. There should be policies and procedures for procurement of required equipment meets as required for the patients for the specific services you are providing. So this facility management will totally vary. If you are a hospital-based telehealth services, then you have a hospital as a facility. Then you may have a specific designated area from where uh, you are delivering the telehealth services. You may have a different mechanism. You may have everything in one place, and then doctor comes and they get connected with the patient and offer the telehealth or telemedicine services, or they may be sitting in different part of their own hospital, on chambers in the hospital, and then there's a connecting point. It may be a totally standalone telehealth platform, right? It may be totally off without any physical space. It's totally virtual. So you have servers all on cloud, everything put on cloud. There is a website which allows anyone to get in touch with a doctor or the physician he or she is looking for and get connected and then establish connection for providing telehealth and teleservices. So it may be totally virtual. There is no such thing. So in that case, this facility management may not be applicable because you don't have anything which exists. But there would be something. Even then, in virtual case, you will have a company which will be running and operating this from somewhere. Some people will be sitting and managing some activities. So that would part of this facility management. And if it is a hospital base, as I already mentioned, then those components would be looked at in terms of these requirements. The facility has an operational program for the management of utility system. So it all any utility system, electrical, gases, whatever water, whatever is required for functioning of that telehealth facility, not the entire facility. If it's part of a bigger organization. A risk management plan is to be prepared and implemented, and this risk management plan should capture all potential and possible risks which might come across, depending on the type of services you are offering. Risk management plan specifically address risks associated with epidemics and pandemics. So, like you have seen, COVID-19 pandemic has created a lot of problems and troubles for healthcare facilities, and therefore they should capture anything like that, including any epidemic. Information management system. This is one of the most important when we talk about telehealth. A documented policy and procedure exists to meet the information needs of the telehealth facility. So this is all about what is your information need as a facility, what information you actually collect, and once you collect, then how you collect, how you store, how you disseminate, how you dispose. So all those things will be part of this chapter. Telehealth facility implements a robust document control system. So document control system means that you have a system where you control which document exists which place and who has access to which document. And essentially, the basic principle of document control is that to make sure that the right document is available to the right person at the right time, at the right place. So to avoid any use of obsolete documents which are not supposed to be used. Telehealth facility implements a robust system of controlling and managing data and information that is interoperable for information portability across doctor and patient. So interoperability of data information is important. The devices to be used as far as possible should be interoperable. They should be talking to each other so that the data information can be shared with multiple doctors or and with the patients if needed. The telehealth facility defines what constitutes a medical record and maintains it for all patients. So you define what do you mean by a medical record in your facility, and accordingly you maintain for all patients. Telehealth facility maintains complete and accurate medical record for every patient. So after you define what constitute, what should be there in there, then you compile all those information and records and keep it for every patient. Telehealth facility has documented policy and procedure for maintaining confidentiality, integrity, and security of records, data, and information. So this is about how you ensure that your data, the information you're capturing, is always kept confidential. There is no one who can play around, and it's always safe. Nobody can destroy, destruct, and take away from there. There is a documented policy and procedure regarding the retention time, retrieval, and destruction of records, data, and information. It's about your policy that how long you will keep any information you receive, and when information is stored, how you retrieve it. And the basic principles remain that you should be able to retrieve as early as possible. So you should be arranged in a manner that you get that. And then after things are not required and they are over by the retention period, then how you dispose them off. The telehealth facility regularly conducts medical record audits. So you do medical record audit frequently to check to see whether you are able to maintain the medical records as they should be. Now, chapter 5 is about continuous quality improvement, CQI. There is a structured quality improvement program. So this is about that you define your quality improvement program, taking into different parameters into consideration, monitoring things depending on the nature of services you are offering. And you should also have a patient safety program. So first is quality improvement program for all for entire facility, and then patient safety specific to the patients, how you ensure that your patients remain safe when you're offering telehealth. So telehealth facility defines and monitor performance indicators. So you define your performance indicators and start monitoring. This may be your turnaround time. This may be taking up call or failure of calls and connection. It can be anything which you like to define as a performance indicator for your telehealth services. Then it comes patient assessment and care, PAC. Telehealth facility defines and displays its services so that everyone knows who is interested to get your services. They know that what services you're offering, and if they need it, they can approach you. The telehealth facility has a mechanism of identification of any doctor who is providing the patient the telemedicine and facility for patient identification as well. So how you identify that who is he providing telehealth? He's a real doctor or who? So there should be a mechanism, and also how you know the who is patient, how you check the identity of a patient, how you ensure that the doctor, if I have say I want a consultation from Dr. A, how I would know that he is Dr. A. The telehealth facility has a documented registration process. So this comes as you come to your hospital, what is your registration process. So as a patient on board to receive your telehealth services, then how you start registration. Maybe is there any form they need to fill, or they just call up, or what is the mechanism for registration. The telehealth facility has adequate mechanism for referral of patients. So in case when you're providing telehealth services, and at the point of time you know that now this patient need to be going to some other doctor, either on again maybe tele or maybe in person, then you should have a mechanism for referring those. Initial assessment is conducted of all patients being cared for by the telehealth facility. So that's remain a basic rule that as soon as the first contact is made, that patient to be assessed initially for the type of parameters is needed as per the complaint. Telehealth facility has a process of patient management, health education, counseling, and medication. Facility ensures uniformity and continuity of care. The health facility uses the patient-centered approach in the care provided. So patient-centered care is basically where the patient remain in the center of care, and then there are physician, means the care providers. There are it means hospital or whosoever telehealth service provider or someone provider of the care, then the family around. So whatever you do with the patient, you also discuss things with patients and or the family member, making it more patient-centric. Means the means what is patient specific needs might be, what may be the specific requirement for a specific patient. They may vary from patient to patient. So you keep at the patient to talk to patient relative, and then make it happen. So it's a consultative process where everyone is included. A policy and procedure exists for any research activity. So if you are involved in any research activity, then you write down your policy and procedure for that. Then comes patient rights and education. As we all know, patients have certain rights while receiving medical care. So similarly applicable to telehealth, patient telehealth facility protects rights of patients. So how you protect rights of patients? Until as you define it, you define, implement, use them. That means you are protecting their rights. Patients are informed about their responsibilities while receiving consultations. It's not just rights, but responsibilities as well. So you tell the patient that this is your responsibility as well, and follow it, please. The telehealth facility identifies and documents the rights of patients, supporting individual beliefs, culture, and values. The telehealth facility educates the patients and family to make informed decisions and their involvement in care plans. This is what is patient-centric care is, where you really educate patients and their families to make informed decisions by providing all possible information, pros and cons of specific procedure, and then make them decide on what they want to choose. Telehealth facility documents patient consent. That's very important. Where you need a consent of the patient, then you have to take, and then you have to keep the record of those. The facility has a documented feedback, whether it is compliment and complaint system. So you should have a feedback system where you capture any commendation, any compliment, good things about you or your services, and also complaint. If anyone has a complaint to make against the services and someone working there, then what that mechanism is. Then comes the medication management and safety, MMS. There is a documented policy and procedure for the prescription of medication. This is very, very important that you prescribe medication as per the defined policies. And this policy may be based on what is the legal provisions that exist for telehealth, depending on which country you are practicing. In maybe some country, everything is acceptable to be prescribed online by telehealth, telemedicine, but not necessarily in all. So whatever boundaries are there, you have to follow those. The medication prescription complies with telemedicine practice guidelines used by respective council from time to time. So if it's in India, then you have a National Medical Commission, you have Central Council for Indian Medicine. who govern these things. So you have to follow their guidelines. As we know that NMC, which was MCI earlier, they have released guidelines in 2020, and these standards are almost have taken all those guidelines requirement into this. All prescriptions are evidence based. Prescription policy ensures age confirmation of the patient before a prescription is issued. So this is about age specific prescription to ensure that everything is okay. So you have to say, you have to prove and take the evidence that they are of that age. A facility has a system of monitoring of adverse drug events in case you prescribe some medication and it is an adverse drug event. So how you monitor that? WHO Global Patient Safety Challenge: medication without harm is documented and implemented. So WHO has brought out medication without harm as a third patient safety challenge just 2 years, yeah, 2 years ago, 3 years ago, 3 years ago, which is called medication without harm. Considering the medication errors are happening around the world in large number and harming patients, so this medication without harm is a new challenge, a global challenge on patient safety. Now, hygiene and infection control, very important and particularly relevant to those healthcare facility, telehealth facilities which are based in a hospital. For standalone, they may not be that much applicable. They will be only applicable for those staff who are into that specific facility to manage the telehealth platform. Otherwise, more relevant for, because patient is not there, patient is away, right? But it may happen the patient is in the hospital. Now, patient wants telehealth services from someone, right? So if that facility is offering the service, that's not responsible because the patient is somewhere else. It's not within the purview of telehealth service provider, right? So if there are certain facilities who are providing places where patient go and then receive the services, and that facility is belonging to the telehealth service provider, then this becomes applicable. Then they have to really ensure that you have a comprehensive hygiene and infection control program, and you implement the workplace hygiene and infection control practices like COVID-19, distancing, use of masks, cleaning up, and all those things. So all those things would be applicable, but it's more relevant for a telehealth service provider which is based in a hospital, because now you have people there, and hospital is a risky place. So if there is a staff working there for telehealth, then you have to take care of those. Of course, patient is not there, so don't worry about the patient infection. That's always away. But other people, the working as a staff, support staff, or doctor itself, they need to be really, taken care of. Now, last 10th chapter is about digital health application. When we are talking about telehealth, and that's become important. So telehealth facility has defined technology-based tools used for patient consultation. What technology you use for consultation? Is it just an ordinary telephone, or is a video-based system, or it is a audio-video system? It is a wired, it is a wireless. It is what type of system you are using, what type of technology you are using to provide teleconsultation. Technology platforms used across a network of the doctors, the physicians are designed in a way to support compliance with applicable guidelines. So if there's any guidelines existing in that country or in that place where these services are being provided, then they have to follow all those requirements and talking to each other. Telehealth facility aspires to operate within the framework of National Digital Health Blueprint. This is specifically put in as we have in India the National Digital Health Mission now, which has brought out National Digital Health Blueprint and the guidelines, the framework. So we have captured there is some requirement for quality and safety in that document. We have taken that document and put into this standard as well. So this is complying, and also is an open and for any services elsewhere in the world. So whatever is applicable guidelines, regulations are available in that country would be essentially applicable to that. So that's about the outline of standards, and quickly through the process of accreditation in case any one of you is interested. So we have a process of self-assessment based on a self-assessment toolkit designed in line with the standards for accreditation. So you apply within a specific application form plus self-assessment toolkit plus all reference documents in this toolkit and an application fee. We review the application and provide the registration number, specific registration number, and and if there are any deficiencies in the application or anything which you submitted, we review and come back to you that this is what is more needed. And then after that, we appoint an assessment team to carry out the assessment. The assessment is, this is telehealth, so basically is going to be the remote assessment, but it may be depending on the situation, might be on site if it's required, or maybe hybrid, where on site and virtual modes are used depending on situation, depending on type of facility, the mode can be chosen. But we would try as possible to do by remote, because that's most of the things can be determined through online. So that team, assessment team, then prepare a report and submit to us in secretariat. We look at it. We look at all the scoring requirement for each and every element, every criteria, standards, and overall chapter. And then, if there are any non-conformity, is any gap identified during assessment, the facility is asked to take the appropriate corrective actions and then submit those action plan with corrective actions to us. And once we receive all the report and all scoring is in order, corrective actions are acceptable to the assessment team, we take it to the accreditation committee for their review and recommendations. So accreditation committee review it and then recommend it for grant of accreditation or otherwise based on the outcome. And so if that happens, the certificate is issued for 3 years. And in the middle of cycle of 3 years, between somewhere from 15 to 18 months, there is an called surveillance assessment, which we do to check the continued compliance for the standard. And then you apply for a renewal 6 months before the expiry, so that 6 months we can complete all the necessary formalities for renewal, and then you don't have a break in the accreditation cycle. So thank you so much for your kind attention and attending this. And if you have any query, you can send your email to himanshu@qai.org.in by email. But I'm here at the moment to respond to any query of any one of you have. Thank you very much. And now it's open for questions if you have anyone. Hi, Amit.
Hello, sir. How are you doing?
Good. Thank you so much.
Nice representation, sir.
Thank you so much. Anyone is any questions from anyone? Some more information? Would be happy. We have Dr. Nidhi, Sapan, Amit, Kalgi, Dinesh, Hugo. If anyone of you.
Sir, this is Amit. What I have gone through, I mean, in couple of peripheral hospitals, they have installed that litmus machine, litmus LX or something. That's a comprehensive machine they have been using, and that has been handled by a trained nurse. And the patient has to go there. So, does those centers, I mean, for conducting this telemedicine call, falls under the prejudice of this accreditation program?
Yes, there are such facilities coming up, where it's like Apollo Telehealth also set up those things. They have created few centers somewhere in different cities and even the remote areas where patient had to walk in and come in there, and there they have the facility, they have camera, computer, whatever is required for consultation and transfer the data and information and talk to the doctor. So they do it. Similarly, there are one of our client which has applied the India Health Link. They are also setting up kiosk, in different communities in societies, where they connect through that they connect to the hospital doctors, right? So that's yes, possible. Yeah.
Thank you, sir.
Dr. Rana.
Yes, please.
I am Dr. Dinesh Kutoch. I am from CGHS, central government health scheme.
Yeah,
My question is a very direct question.
yeah.
Whether the QI has are in touch with the CGHS authorities that this
Yes,
kind of system should be introduced in the CGHS?
yes. uh,
Okay.
yes, and, we are in touch. In fact, for CGHS is known because I was in NABH for long and I was interacting with all the CGHS dignitaries there, Uh, so after this QA program also, we have been in touch with CGHS for different purpose, including the acceptance of our program for empanelment as well as this telehealth, because this is something which can be explored, where accessibility is a challenge. Um, so in those cases, this really makes my life easier for patients who are in the areas where they can't really get easy access, so they can avail telehealth facilities. So that's we have, but not much progress. Maybe happy to interact with you, or as you advise, we can take it further.
Why I am emphasizing this, because the CGHS has presence in around 40 cities across the countries,
Correct,
and in the CGHS system, all the medical systems they are covered.
correct,
Not only the allopathic system of medicines, Ayurveda, Siddha, Unani, homeopathy, so all are covered. And
correct.
particularly for Ayush, I am a man of Ayush. I was in the Ministry of Ayush. I had been dealing with the NABH standards for the hospitals and for the daycare centers. The important thing is that, particularly for the personal health care, the people they look towards Ayush.
Right,
And the
definitely.
CGHS doctors, these Ayush doctors, they can do a lot of things through this telehealth facility.
Absolutely. So if I'm not wrong, now when you mentioned your affiliation with, you are Dr. Katoj, who were the advisor in IUS, right?
Yes, 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 yes.
Oh, guys, so you, I know you very well, you and Dr. Manoj Nesri, and in fact, I was interacting with you on this issue when you were in Ayush, you know?
Yes, yes, yes. I was associated with the this publication of the NABH standards for the
Uh,
daycare centers and the
I know,
hospitals.
I know. I was there at that time when this was done. So you were there very much. You were
So let
there,
us
and
let us meet someday, and we can discuss on this.
definitely, definitely, I'll get in touch with you.
And Dr.
Definitely.
Rana, I would request that if you this presentation could be shared with us.
Definitely, I'll get it emailed to your email.
Okay,
Yeah,
fine, fine.
that would be great. Thank you so much for. Actually, Dr. Manoj is also registered, but he didn't. I think he didn't join.
Okay, okay.
Yeah, in fact, the project director of E-Sanjeevani, na? E-Sanjeevani, which is CDAC Mohali, has initiated, saying one of the largest government telehealth service provider. So he also registered, but I think he also could not make it.
Very few
Maybe.
participants are there. Hardly 12 participants are there. I
Yes,
think.
yeah, but there were around 46 registered,
Okay.
as you see. But that's why I know who was there in the list. But
Mhm,
I don't know why. Anyway, it's okay.
mhm.
At least you're there, so Amit is there, so that's fine. No, definitely I'll get in touch with you, Dr. Kachoj.
There should be standards for the registration also. Once one is registered, I think you should participate.
Yeah, I think that should be someone has to get registered. Uh, but anyway, it's okay. That's fine.
Thank you.
Good to
So,
hear. Good that you
I
there.
feel,
Yeah.
yeah, I feel this post-COVID, this telemedicine accreditation has got the potential has increased, and it will go far ahead. I mean, in the coming time, or let's hope so.
Yeah, thank you so much, Amit. Yes, we are seeing more traction from outside country than in India. So we are trying to reach out to a couple of those. But like I said, Al Jara Hospital in Dubai, which is a JCI multiple accreditation holding, they started their telehealth services just maybe 8, 9 months ago, and they were very much interested. Though they prepare for good time, and they got evaluated, and now they are going to be accredited as the first international client. And there are now I have a meeting next week with couple of hospitals in Dubai, and chains of telehealth providers like Mediclinic and some other thing. So there is a traction now. There is an interest, and I think it's good to hear from Dr. Katoj that he mentioned that how it can be helpful in connecting and providing Ayush services and all those things. So there is a great potential. I think need to be. In fact, Dr. Katoj, I was actually I'm a part of the technical committee of this RAV. The
Mhm.
new program which is set up for accreditation of training providers which are not covered under CCIM. So we were interacting, and in fact, one of the meeting secretary was talking about telemedicine services in Ayush, you know. So Dr. Anupam was trying to explore on those things. Good. No, it's good. Thank you so much. If anyone else has any questions, any more? Rema, please note down, we'll send a PPT to Dr. Katoch.
Noted, sir.
Yeah. And I'll speak to you, sir, next week. We'll get in touch and see how we can explore. Yeah. Okay.
Put an email, I will send my phone number to you.
Please.
Or you can just note down. You can just note down.
Yeah. You can just tell me. Yeah, please.
99680
99680
7
7
668.
668.
This phone number as well as WhatsApp number.
Okay, this is the person number as well. I think I should. Okay, so your number is changed, right?
No. The previous one now, since I have come back to CGHS Ministry of Health, so every day I used to get around thousands of messages, so I stopped that.
Okay, that's why I'm saying I have your number 1103. So
you can say both the numbers.
Sure. I have noted
99680 7 668.
Definitely, I have noted down. Thank you so much for that. Thank you so much. Okay, then I think let's close for the day. And it has been a good time. Thank you so much, Dr. Katoch, for your questions and your presence, and Dr. Amit, all of you who has been here. Thank you so much. Have a good day.
Thank you, sir. Thank you.
Have a good day.